Hello, everyone. I'm just trying to put a call across to pharmacist Gift so she gets ready. I was supposed to come here on time. Hello, who is online? Before I start seeing my stories, just click on the link I've sent you. All right.
To click on the link.
Yeah, do. I'm live already.
Okay, no problem.
So, I'm trying to get the speaker to be around because she's the one that's going to talk about the ulcer. So I've called her. I've sent the link to her. While waiting for her, think we can have a chit chat. Yeah, we can have a chit chat while waiting for those pharmacist God's gift to join us. Actually, we can have a chit chat. Hello, everyone. How are we doing? And trust we are doing great. Today we're going to be talking about more of ulcer. Yeah, I know this is practically not much what we talk about. Um, okay, I'm going to answer. I'm going to be talking about peptic ulcer. Was a question that just popped on my um on the comment section that just made me laugh. Like, but first of all, I'll answer that question. And it's funny, I just remembered exactly that nickname I was called. God. Ah okay. Okay, let me sort it out. What's the person's name? Dean Chill. I'm gonna answer that question when our speaker is around, when pharmacist gives us joined this live session. I'm gonna answer it. Let's see. Hello, everyone, and how are we doing? Welcome to another live section with Nurse Mercy Mary. Yeah, welcome to another live session with Nurse Mercy Mary. So I'm going to be adding her up. Let's see. Add. I've added her. Why is it not adding? This thing is messing up. Sorry. Okay, I think it's coming up now. Okay, yeah. We're here. We're here. We're here. Oh,
Yeah.
you've not even arrived yet. I think we're having a question on the comment section that says, is stomach ulcer different from peptic ulcer? But don't answer that yet. Hopefully, during the whole discussion, it's going to like pop up and you're going to explain it.
Oh,
Okay. Um, Let me just do a formal introduction, then I'm going to introduce you. Hello, everyone. My name is Mercy Mary, and welcome to our live section. Today we are not going to be talking about sex. We are not going to be talking about reproductive health. We're going to be talking about something different entirely, and we are going to be talking about ulcer. Yeah, we've heard of peptic ulcer. People say peptic ulcer. People say stomach ulcer. We're going to be explaining the difference because peptic ulcer you have duodenal, you have stomach. But I'm not the one talking today. It's going to be more of less of me and more of pharmacist. God's gift to them. So with us here joining this live is pharmacist God's gift. So I would like you to introduce yourself and tell us what you do and just tell us about yourself before we begin. All right?
okay. Thank you for having me. I hope you can hear me well.
Yeah, I can hear you loud and clear. I can hear you.
Okay, I am pharmacist God's Gift, a practicing community pharmacist. Okay, I reside at Bayelsa State. Yeah, so if you are within Bayelsa State in Nigeria, you will know that we have a lot of pharmacy everywhere. So I am in one of the pharmacy. I am a community pharmacy. Community pharmacies in the sense that when the pharmacies that you go to buy drugs, okay, that is what we mean by community pharmacy. As we know, we have the hospital and others, but I am in community pharmacies and we handle most of almost all the health challenges, then the ones we cannot, without refer to the doctor. So that is what we do. That is what I do. So I want to thank you very much, Nurse Mercy Mary, the nurse with the difference, for having me here. You are truly the nurse with the difference. I am so delighted, and let's begin. Thank you
Okay,
very
I think
much.
for those that don't know about pharmacist God's gift, she has a YouTube channel. What's the name of your YouTube channel so that they can actually subscribe?
Okay, the name of is Pharmacist God's Gift. Actually, I named it Pharmacist God's Gift. If you search on Pharmacist God's Gift on YouTube, you will see me. But you will see health and drug. That is just the name that you will see there. But if you are going to search, it's Pharmacist God's Gift. If you search on health and drug, you will see a lot of channel there. So you will be confused. But if you search on pharmacist God's gift, you're going to see me. You will just see my
What's
picture on your.
I think what's gonna happen is at the end of the session, I'm going to be dropping the link to her YouTube channel on the comment section and also on the
Okay,
description boxes, so that you all can also follow her and learn. We are all learning every day. I think it's important
that is.
for us to be mindful of who we follow. Like it's important we actually follow healthcare practitioners, those that are licensed, and not just roadside people. I believe Goskis is a licensed pharmacist, right?
Yes, yes, yes. 100% license. Yes.
So you can see she's a licensed pharmacy and she have an idea about medications and everything you can think about, right? But me, I'm not a licensed pharmacy. I am a licensed nurse, both in Nigeria
Yeah.
and in UK. And today we're going to be talking about ulcer proper. So which Gosgis is going to take us through what she has for us. But before then, sorry, I have to answer this question. Somebody asked, what is the strangest nickname you have ever been given and how did you earn it? So I'm going to be answering that question. I believe Chill is asking me that question. It may sound weird, it may sound funny, it's really strange, but they called me Monkey Trouble. That is practically the strangest. Like, I was actually surprised when this person came up with it because I was more or less like a troublemaker. You dare not step on my feet, you dare not step on my toes, day your name, things like that. All those hard guest ties. So that was why they gave me
Okay,
monkey trouble. Yeah, that's a
that was
monkey
very
and trouble. It was really insulting in the sense that the person was lying to like, okay, maybe you look like a monkey and you're a trouble, you're a troublemaker altogether. So that was the strangest nickname I have ever received. That I wasn't really happy about it, but it actually gave me the fame and popularity I needed then. But anyway, over to you, pharmacist God's gift. Let's see what you have to tell us about peptic ulcer, medications that are taken, some drugs that are likely. I've heard about some drugs that are likely going to increase your chances of getting peptic ulcer. Let's see what you have to share with us. And if you have any question, kindly drop on the comment section as we go. All right, over to you.
okay. Okay, thank you very much for that. That was quite funny. So everyone, peptic ulcer is also called stomach ulcer, so don't be too confused. But the difference is that when it comes to peptic ulcer, is more like of, let me say, a name that is given to the health practitioners. Okay, so we do it stomach ulcer because of the layman, so that the layman will just say, ah, it happens in the stomach, so it's stomach ulcer. But there is a part of in peptic ulcer, there is a part that stomach pain would be. That is why mostly they just put it as stomach ulcer. So it's almost the same thing. It's just the same thing, and you have to do it the layman and health-wise. Okay, so peptic ulcer, as I will tell you now, is a disease that affects a lot of persons. I made a post on Facebook one time ago now about just peptic ulcer, and I noticed how viral the post went, just because I just stated that peptic ulcer is caused by this bacteria. So that is why today I said let me bring it up, because I've noticed that a lot of persons are coming up with peptic ulcer or stomach ulcer. So and there is one belief that most persons usually have, that peptic ulcer or stomach ulcer is caused by spicy food, or they don't eat for a long period of time, or stress. Okay, those are not the exact cause of ulcer. Okay, what those ones does is that they just like is it indulge it, they just like encourage ulcer. Let me use that word. They make the ulcer to be stronger, or will I say to come up. That is what is it. So it's not that they are the causative agents of ulcer. Okay, like studies have shown that 75% of usually caused by microorganism, which is the Helicobacter pylori. Yeah, very annoying organism because it affects a lot of persons. And I know some people will say, Helicobacter pylori, how do I get it? How do I get it? You contact it from your physics. And also, if someone that have this Helicobacter pylori in them come in contact, direct contact with you, like kissing or kissing, that like direct contact with you through mouth, you know, with the saliva coming with your saliva, then there is high chances of you coming up with peptic ulcer because you too have gotten access to the microorganisms. So it also comes with contaminated food and contaminated water. When the organism has contaminated that food and the organism has contaminated that water, so it's mostly gotten through the physics. That is why you see us, we always advise our clients to wash your hands properly when you use the toilet, because the physics carries a lot of microorganism. Okay, so that is the number one cause of peptic ulcer. We
Um,
say the number one. So then other ones that cause peptic ulcer are, okay, drugs. If you are in Nigeria, you will get used to this word that we say body pain, or we say pain relief. Yes, they call it pain relief. Like those that like going to the chemist, they don't like going to the pharmacy to seek the pharmacist's consent. They like going to the chemist. What the chemist does is that they mix a lot of drugs. They will mix ibuprofen, they will mix diclofenac, they will mix felvin, which is a paraxicam, they will mix all the NSAID just to bring that pain down immediately. But that is causing something very dangerous and very bad to your body, which is the ulcer. That is what I call the NSAIDs that are the causative agents of ulcer. So the NSAID are just your fairway, and mostly ulcers are ladies. Yes, our ladies, we have a lot of menstrual cramps and pain, and you know this NSAID are mostly over the counter drugs. You can go and get them, so ladies do abuse them a lot. When we come up with this pain, we'll quickly go get it, and most of them come in combination. You will think that the drug you're taking doesn't have that drug. If you can read very well, you will notice that that drug taking has that diclofenac or the felvin in them. And you still want to add another NSAID again, and with frequent
yeah.
use of this drug, there are
Okay.
chances of you having ulcers. And you know, ulcers are like
Sorry to
wounds, they are,
Babasi,
yeah.
sorry to cut you short. For all those that are dropping their questions, we are not going to take the questions now. All the questions I see on the comment sections are going to be taken after the video. Okay, we're going to take all these questions after the video. All right, and I'm still going to be contributing my own idea from nursing perspective about ulcer too. All questions will be answered after the live section. What you can do at the moment right now is to drop a comment, just drop a comment or say hi to the speaker. All right, you can continue. I'm sorry for cutting you short.
Okay, so thank you for that. Back to what I was saying. Ulcers, as I said, are wound in your stomach. Okay, those wounds can occur in different parts of your stomach. They can occur in your duodenum, your gastric region. That is it. So you don't be wondering what ulcers are. Just like the normal word, it just sores, open sores that are in your stomach. Okay, so this food and this spicy food and other things that you think that causes ulcer are not the real cause of ulcer. What they does is that they just aggregates the pain of ulcer. Okay, they increases the acid of ulcer. Even stress increases the symptoms, or the now what's the symptoms, as in what the ulcer will make you to feel. Okay, so that is what they do. They are not actually the main cause of ulcer. So I hope today you've known what causes ulcer. So when you come to the pharmacy, don't come and tell us that, yeah, it's because of this. I think the ulcer is caused by this, because I have a lot of clients that we even drag with me to the point that, is this thing that caused my ulcer, is this thing. So me now, I don't know. When I leave the bedroom, I wash my hands. When I do this, I said, even though you leave the bedroom, you wash your hands. You don't know if you have eaten contaminated food, or you don't know if you have kissed your spouse that have this ulcer from the saliva. Okay, and also there are some people too. If you think that all these things are not working, there other disease that can lead to this ulcer. Okay, so if you think that you are free from all these things I've mentioned that causes ulcer, there are other diseases that causes ulcer, and also smoking and alcohol, I know a lot of people will know that alcohol causes ulcer, because alcohol is very strong. So alcohol too causes ulcer. Those
Do
are
we
the things
say
that cause.
alcohol and smoking causes ulcer, or it predisposes them to develop ulcer?
Yes, it does that too, but alcohol too, it causes ulcer.
Okay,
Yeah.
alcohol causes
Then
ulcer.
yeah, studies they have shown that alcohol too also leads to ulcer. That is
Okay.
it.
Okay, I was having the
Yeah.
mindset that alcohol and smoking predisposes one, like puts them
Ye-
at risk of going down with ulcer, but it's not necessarily a cause. I was just thinking it's just the bacteria,
Yes.
Helicobacter
Yeah.
pylori, that causes ulcer. But when you take alcohol and you smoke, it puts you at risk. Okay.
Okay. Yes, I had that thought then too. So back then in the university, our lecturer got to clear us that
Okay.
alcohol too ulcer. Okay, so it just like as you're taking it, it causes wound in your stomach. So the pathophysiology is not
Yeah.
known yet. I was trying to check the pathophysiology myself too, but I've not gotten it. So, and if I get it, that is going to be a long one. Yeah, a
Okay.
long explanation. Yeah, so that is it. Then I want to say for those that say, why is it that my ulcer is not going? Why is it that my ulcer is not healing? It means there are a lot of things that are happening that your ulcer is not healing. It means that you might have taken some drugs as you are treating the ulcer. It means that you might have been taking this NSAID also. There are some persons that are stubborn. That pain, if that is why I said when you have pain, when you have something, you always come to the
Yeah.
pharmacy or you go to the hospital. Yes, because we know better than the chemist. You have stomach pain and you are still going to take this NSAID for that pain because NSAID are made for pain, not knowing that that particular NSAID is not meant to be taken by an ulcer patient. So that is one of the reasons why ulcer keep coming back. And another reason why ulcer keep coming back is because most persons do not comply with their drug. If you are in Nigeria, you will know that a lot of us do not comply with drug. My clients will say, as far as the pain is gone, the drug, that is what they will always tell me. I say, no, try and finish this drug. This is antibiotics. You're abusing antibiotics. They will say, no, as far as the pain is gone, let it stop. Let me go and hustle. So most of them.
Oh, network, I think. So we just give her some. I think network is waving a bit, so we're just going to wait for her. It's just the network issues. Okay, she's back.
Okay. A lot of persons take things that are they are not supposed to take, like most persons chewing bubble gum on an empty stomach. No, that will cause more acid. You know, the stomach will be expecting food. There is no food. So it will make those pump in your stomach to start producing more acid into your stomach. So that is one of it. And citrus fruits like all these lemons, the oranges, all those ones too cause more acid in the stomach. Okay, there are a lot of other ones too, like spicy food, your fries that causes more acid in your stomach. Okay, and some persons, there is one thing I've noticed: a lot of persons do take milk when they have that. Uh,
Yeah,
uh,
yeah, yeah. I've seen it a lot, like a lot.
but that is dangerous, quite dangerous. Okay, that will just suit the pain for the minute. After that, what that will cause is that it will cause more acid in your stomach. Okay, so it will just give you that soothing relief for the minute. After acid in the stomach. So these and many more are some of the things that you are doing that ulcer have not gone totally. And you know, ulcers are wound, and wounds take
Yeah,
process to
very
heal.
true.
It okay, so it needs the drug to heal them. But if you are doing things that are not favorable to this wound, how will they heal? They will just be there watching at you till they will just calm down. Till anytime you do things or you go hungry for a long period of time or you do things that will make them come back, they will come back and start disturbing you. So that is it. Then, okay, let me tell you what you will feel. What are the symptoms? You have been saying this. So some persons that don't have this ulcer at all will be wondering, so how will I know I have ulcer? Okay. So the first thing that you will know is stomach pain, peptic ulcer, stomach pain, and the pain is at your epigastric region. So you want to be wondering, okay, below your rib case or upper part of your nose, that
I wanted to
part.
ask
So when
because I'm glad you were able to talk about epigastric pain because I was like, that grammar will be too big for some people to understand. But
yeah,
thank God you're breaking it down. That's good.
yeah,
Okay.
yeah, that is where the pain is. So below your rib case and upper of your navel. I've noticed that when a client comes to me, the first thing I want to be sure that is a epigastric pain, that is ulcer pain. I used to give that place a thick sharp. Then if I get this sharp feeling of ouch, yeah, I will know that this person is ulcer. There are some persons that you touch there, they'll say there is no pain. Because I've heard of one sickness that is quite similar to ulcer, that if you finish treating ulcer with all the symptoms and it's not going, you should go and carry out tests and check for that sickness. But I've forgotten it for now. Okay, that is that for that. So but if I want to show is ulcer, and there are some person, we are in Nigeria, it's not everybody that wants to go and run tests to check if it's the microorganism that is causing it. They'll say there is no money here, just do the way. So if I want to do diagnosis and check out myself, that is what I do, that epigastric pain. Then I will ask them, do you have bloating? Do you have constipation? Is your stomach so big that when you hit it, it will be sounding like empty drum? So I'll ask all those questions. That is one of the signs of ulcer. And also there is another one, severe back pain at night. Okay, the pain is to run. Okay, so I've had that pain before. That is escodo. So the pain will run from your back. It will be moving, radiating from your back to your waist, to your abdomen. So, and if you're sleeping at night, it's as if the world should just come down. So that is how that pain is, very annoying pain. So that is another sign to show bloating. If you know that you have constipation, severe pain, among others, if you are feeling this symptom, just rush to your pharmacist or to your hospital, because that might be sign of stomach ulcer. Okay, those can be signs of other things. That is why I say come to us. Let's do the diagnosis ourselves. Okay, don't go and do self-medication. So those are the signs. Then you will be wondering, so what if I do not treat this ulcer now? I want to neglect it. What if I don't treat this ulcer? What will happen to you? Hey, I'm chief. No, if you don't treat that ulcer, it's going to lead to another stage,
Yeah.
another thing that you won't. So
And even
it's
result
going
to
to lead,
gastritis.
yeah, and also internal bleeding.
Yeah.
Yeah, and internal bleeding is very bad, and it's going to lead to also bloody stool. You will be having dark bloody stool, and that is very bad. It's going to take a long period of time to heal up. Internal bleeding, you'll be wondering you are bleeding inside. If you poo, you'll be pooing out blood. You cough, you'll be coughing out blood. So it's very bad. So please don't keep that ulcer there. It can lead to death, actually. It can lead to death. I've seen cases that it leads to death. So please treat that ulcer. Okay, so nurse, will you want me to say the treatment pattern? Yeah.
Okay. Before you say the treatment, I will just go over what you said, what we've learned so far. Okay. I'll
Uh,
just kind of give a brief. So,
great.
for those that are just joining us, this is Pharmacist Gifts, and like Ella said, she has a YouTube channel. You can also follow her to also learn. It's important to follow healthcare practitioners that are licensed, that are able to give us useful informations and not just roadside informations. Okay, so she has been talking about ulcer, and she has been able to make us to understand that spicy food is not the cause of ulcer. Spicy food, hunger, they are not the major cause of ulcer. She made us understand that there's a bacteria called Helicobacter pylori that is actually the cause of ulcer. For me, I was actually thinking alcohol is not a cause of ulcer, But she was able to made me understand that alcohol, smoking are causes of ulcer. There are researches that have backed it up that says that they are causes of ulcer. So if you're having any ulcer symptoms and you are smoking and you're having alcohol, I would advise you to stay away from it just for your health. And also, my own addition is that when it comes to peptic ulcer, there are two types of peptic ulcer. We have the stomach ulcer and the duodenal ulcer, like different school of classification.
Yeah.
So if we just say peptic ulcer is like same as stomach, is you can say that it's similar. So we have duodenal ulcer and we have the stomach ulcer per se. Because for those that have the knowledge of the digestive system, I believe everybody did digestive system in school. You see, we have
Yeah.
the stomach. After the stomach, you have your small intestine, which the duodenum is part of it. So there could be, I think, esophageal ulcer. No, can't remember that. But we have I know we have the stomach
Sure.
ulcer. Then we have the duodenal ulcer. So when there is ulcer
Yeah.
in either the stomach or duodenum, that can result in those pains that pharmacist Gift has shared with us. Ulcer is actually disturbing a lot of people. It's not as it seems. You get, and people not sticking up to their medication, like she said, is going to make it to reoccur over and over again. Pharmacist Gift made us to understand that it is very important we take our medications. It is very important once your doctor gives you a particular duration for your medication, you should take it. She made us to understand the importance of taking these medications, sticking to these medications. So if you are having an ulcer and you've spoken to your doctor, or in your country, pharmacists do go ahead and give prescription, you've spoken to them, it's
Yeah.
important for you to take that medication as swiftly as possible. But what I would
Yeah.
also advise is that, like in our own country back home in Nigeria, pharmacists can give their prescriptions, they can actually treat some illnesses, and when it becomes severe, it goes to the hospital. Same applies here in the UK, but I don't know about pharmacists taking care of ulcer, but different location determines there are different modes of treatment you get. But since it's okay in Nigeria, yes, pharmacists can make some useful diagnosis and give treatment. Instead of you to visit a roadside chemist that have no idea about these things, it's advisable you speak with a pharmacist or you speak with your doctor and get useful treatment. Don't self-administer drugs. Don't take medications because your colleague said he or she has ulcer. They use this particular treatment, then I should use it. Okay, you don't do that. So that is what pharmacist gives have been making us to understand when it comes to peptic ulcer in general.
Yeah.
Take your medication, make sure you take it swift. If you know you already have ulcer, stay away from spicy food because all stay away from
Yeah.
hunger because all these things are likely going to aggravate the pain. They are likely going to aggravate the symptoms. Generally, I used to believe that ulcer is not treated but can be managed. So once you know you have
That
ulcer,
is it.
it can be treated. What you can do is to manage it.
Yeah.
And how you manage it
Yes,
from what
that
she
is.
told us is spicy food, alcohol, smoking, stay away from it. Stay away
Yeah.
from these things. So once you stay away from it, it's able to all those things that aggravate. Oh, whenever I take this particular food, my stomach's like gets angry. Stop it. She talked about bubble gum, chewing gum when on an empty stomach, drinking alcohol on an empty stomach. That is going to aggravate the symptoms of peptic ulcer, like she said. So these are the things we should take note of. And if the pain is there, kindly speak with your doctor or your pharmacist for useful guidance and information. So pharmacist Gates is going to tell us some treatments that she normally use. I don't know what she's going to tell us though. I'm not a pharmacist. I don't give prescription. I'm not licensed to give any prescription. I'm not licensed to talk about medications. I'm licensed to give nursing care. So she's going to be telling us about the treatment form that they normally use, and I believe we all are going to benefit from it. So,
Thank you for that. Yes, that recap was so wonderful. As you said, you cannot cure ulcer. Okay, it's just management. But that is like diabetes and hypertension. It has entered the stage of management. Take it, it goes down. After a while, it comes up. When you do things that will make it come up, it comes up. So that is just something bad. So, but Anyway, we are going, we are living. That is just it. Since we are living with most persons are still living with hypertension, they're healthy. Even with HIV, they're healthy. So also it's just a small thing.
Yeah.
The treatment
Plug something.
pattern.
Continue. Just continue, please. I'm just gonna plug my heater close by. Okay. Yeah.
Okay. The treatment pattern for stomach ulcers or peptic ulcers, as you all have known, that as I've told you, is caused by microorganisms. So the thing that you should put in your mind is antibiotics. You know, antibiotics are what that we use to destroy, kill, or eliminate
Yeah.
microorganisms like the bacteria. Okay, ulcers are caused by bacteria. 75%, okay, studies have shown that 75% of ulcers are caused by bacteria, this Helicobacter pylori. So antibiotics are the first drugs of choice because we need to kill that microorganism. But before then, you have to go carry out lab investigation because it's not
There's so
everybody
much.
that is organism that is causing the ulcer. Okay, some persons might be that is our
Oh, she's having some network issues, so just give her time. Okay.
first thing we are going to do is go carry out laboratory investigation. Let's know the exact microorganism that is causing the ulcer. So when we have been able to detect that is bacteria, then we'll now give antibiotics. So
Oh, there's network hinges. Network. Sorry.
okay. So the antibiotics of choice are mostly we do combination of antibiotics because the Helicobacter pylori is very stubborn to kill, as in it's very hard to destroy. Okay, so and a lot of persons after even taking complete of their treatment, it might be that the microorganism is not totally destroyed because of resistance or as a result of microorganism not being able to being susceptible to the drug or the drug not able to kill the microorganism even at standard concentration of the drug resistant. So so the most we do is combination of antibiotics. If you come to our office or you come to our places, we are going to arrange combinations for you. Okay. So even if I call the combinations here, you are not advised to go and take it by yourself. So if you have ulcer, you should put it in mind that the first thing you are going to do, they are going to give to you is combination of antibiotics. So if you have two antibiotics given to you, don't be surprised. That is how it's being treated. Then, secondly, is we give drugs that are going to block those pumps. There are pumps in your stomach that are just like pushing out the acid. So we are going to give you drugs, and this drug is going to like receptor. There are receptors there. They are going to block those pumps, and it's going to prevent the overproduction of acid into your stomach. So that is what we call the proton pump inhibitors. Inhibitors is just a general name. Okay, proton pump blockers, inhibitors, that is what we call them. So then thirdly, then you are going to give you antacid too. Yeah, we like to give antacid because antacid helps to neutralize every acid in your stomach. It reduces the acid in your stomach and it will reduce that bloating, that
I believe a lot of us are enjoying the
yeah,
section. She's just having some network issues. Okay. Okay, she's back.
yes, yes, this is a Gaviscon. Yeah, Gaviscon
Gaviscon.
that a
Yeah.
that is antacid and it has this peppermint flavor and it's very good. What it did that epigastric pain that you usually have, it helps too. Even also gives this shortness of breath. Okay, it makes people have difficulty in breathing. Yeah, I've noticed that there will be palpating, they can't breathe very well. And mostly when you give this first aid to ulcer, all these gestid and all of that, you will notice that it will calm down immediately. So that is one of it. It brings down that. So that is it. Then when we give the antacid, then after that we can now go to pain relief. We will now select the best pain relief for you. Okay, there are some NSAID that does not affect COX-2. Okay, we call it non-selective anti this thing. This one is non-steroidal anti-inflammatory drugs. Those are the ones that are not good for ulcer, but there are other NSAIDs that are very good for ulcer. So we are going to select those ones to add it to your therapy, your drugs, so that when you take it, you know that the pain is going. You know that the excess acid in your stomach is reduced. You will know that that epigastric pain that you are feeling has calmed down. Even the back pain and everything has calmed down. So we first do antibiotics, then the proton pump inhibitors like your omeprazole, the lansoprazole. A lot of persons know omeprazole, yeah. The omeprazole, the lansoprazole, the esomeprazole, all the prazoles, yeah, they are called the prazoles. We give that. Then the antacids, and which is what I've called the Jawacil, the Gestid, the Polygel, and so on. Then the antibiotics, we can do mixture of metronidazole, amoxicillin. That is one of the simple one that I'll call for
She's
you.
saying, sorry
So
to cut you short, she's giving you this medication. She's not saying go and take it. She's not doing anything self prescribed. We're saying it, she's just saying it as a pharmacist. Because definitely when you search the
yeah,
internet, you're going to get these medications, but that doesn't give you the right
yeah,
to go and self medicate. It's better for the doctors to examine you first and know the proper medications to give you. Okay? Because I know back home, like a lot of drugs are being abused, like people can easily go to the
yeah,
pharmacy and get medications, and these drugs have been abused. So please and
yeah,
please don't self-medicate. Don't self-medicate.
yeah.
Speak with your pharmacist and speak with your doctor for proper guidance. So while we are saying
That
this,
is
we are still emphasizing on the fact that don't self-medicate, please.
med. Please, this is not to change your therapy. It's not to change your drug therapy, and it's not for you to go and take them. Like me, if they come to my pharmacy, I will say, come inside, let me talk to you. I want to buy omeprazole. What do you want to use the omeprazole for? I'm having ulcer, my doctor gave it to me before, so I just want to, madam, he gave it to you before, but now let's discuss. I will have to take you inside, know what is wrong, and give you the drug myself. So please don't go do self-medication. That is how I was kind of skeptical to call the names, because if you are
Oh, Nigerian network. I don't know why the network's just messing her up. She's actually delivering a very interesting lectures. But the network, like, it's kind of messing the whole thing up, which is not nice. The network is messing it up. It's cutting our interesting section. Network is cutting our interesting section, and it's not nice. Okay. So you've heard what she said. Don't self medicate. So when she was talking about antibiotics, what was coming to my mind was
yeah,
a video I actually did, where it's a short clip and they're like, what's the opposite of antibiotics? And like oncobiotics. So practically when you're talking about taking antibiotics, I was like, oh, oncobiotics. The opposite of antibiotics is oncobiotics. All right, thank you very much, pharmacist God's gift, for this wonderful section. I actually learned a lot. You can see it's been long. I remember making a video about ulcer years ago. I can't
yeah.
remember. Yeah, it's been long I actually studied about ulcer. But thank you very much for awakening my memory about ulcer and what I need to know. And I believe a lot of people have learned a lot from this video about ulcer. So if you've learned a lot, why don't you click on that like button? Click on the like button. Yes, click on the like button. You've learned a lot. Appreciate this section from Pharmacist Gift. It's not really easy to come up and actually educate people. For her to take her
Yeah.
time, her energy, everybody is busy. For her to take her time, her energy, it's something I feel people should learn to appreciate. Tell her thank you in the comment section. She deserves all the accolades for coming down to educate us. We all need to be educated properly about our health. So what's going to be happening now is that we are going to be taking as much questions as we can. Again, I am going
Yeah.
to be talking. If there's any I can answer from a nursing perspective, I will. But most of the questions are going to be answered by our guest, pharmacist Gus Gift. All right. So I'm going to be checking all
Yes.
the
Yes.
questions. Then you tell us. So what? Someone is asking. Uroro Victory said, "What is the best way to deal with stomach ulcer?"
Okay.
Like you said
Okay.
it in
The
your
best
video,
way
but just
to.
give an insight.
Okay. Inside, okay, as I've said that stomach ulcers are ulcers that occurs in your stomach. They are wound sores that occurs in your stomach. So the first thing is the best way to to deal with ulcer is know the cause of the ulcer. What is the cause of your ulcer? Is your ulcer, does it occurs when you keep yourself hungry for a long period of time? Does it occur if you take too spicy food? I know a lot of person that even say they come up with ulcer pain when they stay close to a gas station, like this feeling.
So network is messing her up. So we're trying as much as possible. Network is just messing her up. Okay, you hear now.
Yeah, if you can be able to know the cause of that ulcer, then you are good to go. What is causing that stomach pain? If you are the type that you know that if you lick oranges or if you chew bubble gum too much, you get the ulcer. So just forget
Okay.
about it.
I
So
think
the first
what
thing,
sorry, sorry to cut you short. Sorry, what you're trying to say is that if they know what is aggravating the pain relating to ulcer, they should stop it. Right. Okay. So if you
yeah,
know what is
stop.
yeah, what if you know what is actually aggravating it, you better stop it. If you know, okay, you have ulcer, you've been diagnosed of ulcer, you've had treatment. So if you know, whenever you, like she said, fuel station, I heard that one, that was shocking. If you know when you go to the fuel station, like you start having those ulcer pain, try as much as possible to avoid scenarios like that. If you know, okay, when you chew bubble gum,
Yeah,
when you eat spicy food, these pains are aggravated. If you know when you stay hunger, these pains are aggravated. Try not to um be in a situation where the pain for your ulcer is being aggravated, because that will prompt you to actually use more of these medications. Personally, my sister actually has ulcer. My younger sister is dealing with ulcer at the moment, but it's been managed. Like I earlier said, it cannot be cured because I'm talking from her own experience. She has had all the medications and everything, but when she stay hungry for long, or when she eats
yeah,
spicy food, those two things are what aggravates her ulcer. And when this pain
mm,
come, it's usually very sharp. Like the pain is
yeah,
severe. That sometimes the first relief she usually gets is maybe Gaviscon. She takes it and kind of that kind of help her neutralizes that sensation she gets
yeah.
before she starts thinking of other alternative if that doesn't really work out. So now she tries as much as possible for the fact that recently I think year ago or something. But I know some time ago she now started following her through her dietary routine. She doesn't take more spicy food. She eats her breakfast, lunch, and dinner on time. So ever since she has been following that route of eating on time, taking her breakfast, lunch, and dinner on time, and also try as much as possible to eat less spice in her food, for past 1 year, she has not had that symptoms of ulcer that
That
she was
is
having.
that.
She
Yes,
has
that
not
is it.
had that
Just know
symptom. So
those. There are some persons that even eating carbohydrate food, too much of carbohydrate food, or even beans,
beans, yeah,
protein,
I've heard about beans too.
starts causing
Aggravating
ulcer.
things.
So just know it and limit it. Then you can go a very long time, like years, without even thinking of treating
Yeah,
ulcer.
it's more than a
So
year
that is,
now. She has not really complained about her stomach pain,
yeah,
because I had to start telling her like you have to, like you have ulcer, you have to make sure your diet, breakfast, lunch, and dinner is taken as at when due, and you have to ensure that there's no much spice. I had to start educating her, putting it in her brain. Then she started dietary modification. She started doing it, and for the past 1 year, we've not had a situation where she had to cry that she's having some pains and things like that. So I think diet modification is very important when it comes to ulcer too. very,
Yes,
very
yes.
important. What you take in is very important when it comes to ulcer. So be careful of
Oh,
what you take in. Even like it's not just
that is,
ulcer or God's gift. It's not just ulcer. Like when you are diabetic, when you are hypertensive, when you have some things like the food you eat will go a long way to help you manage that disease condition.
that's
I've noticed it a lot. The food you eat go a long way to help you manage your ailment. So you can't be
yeah,
hypertensive and you are taking a lot of cholesterol, you are taking a lot of fatty food, you are taking a lot of salt, especially salt in your food. You are taking a lot of
yeah,
this congee oil, they call it. So that's not going to go a long
mm,
way to help. So the food you eat go a long way to know if you the what you're suffering from is going to be managed properly or
yeah.
not. So we're gonna go to the next question. We've answered victory. Do you believe in native treatment for ulcer?
Yes, there are native treatment for ulcer, but I don't believe, please, I don't believe in native treatment, okay? Like, I'm a pharmacist. What we know is that most of these drugs, antibiotics and everything are taken from these native ways. Okay, we take these plants, if look like with our opportunity the pharmacist, we take these plants, we take it to our lab, we synthesize, we. But in the native way, they don't do all this synthesis and everything. Okay, they just know that this person have taken before, this person have taken before, and it works. That is what they treat with. They treat with like experience, not with what that drug is actually contain. What this drug contain that is good for another person, that native medicine, what it contains that is good for another person might not be good for you because your body system is different, and there might be other disease condition that you are passing through that you don't know. So please don't do native. If it's good for Mr. A, let it be good for Mr. A. You don't need that native. That native too is not good for Mr. A, but Mr. A is taking it probably because he or she had no choice. So you that have the choice and you have the opportunity, please go to the pharmacy, go to your health provider and take your right medication. As I've told you, those native things, there is no dosing, no dosage. It's just one shot, one shot. No, it's not like drugs. I would say take this 2 times a day or morning, evening, or whatever. There is no dosing. That is just one shot, one shot. And also, they've not gone through any process, no synthesis, no nothing, no purification. It's just boiling and drinking. So I don't believe in native one,
Okay,
please. I
in
don't.
terms of herbal, my own take in terms of herbal concussion or things like that, I don't believe in it. That's one thing. I don't believe in it. I don't. Yeah, I'm African. Yeah, we have a lot of herbal concussion. Growing up, I had a lot of I had a lot of agbo given to me for fever, and to me, then it worked. I won't lie to you.
Yeah,
I'm not gonna lie here. I'm just talking about from my experience. I'm not saying everybody should do it. This is not
true.
scientifically backed up. I'm just talking about. So when I was growing up, my mom, this was homemade prepared. It's made at home by my mom. So they mix a lot of herbs like your cashew leaf, guava leaf, lemon
Yeah,
tree. They mix a lot that they produce this hyper concussion in the sense that when you take it, like you just see malaria leaving you. I'm not saying you should because like I said, it's not scientifically proven. But back then at
yeah,
home, we do have this concussion on a regular basis when we are feeling sick, and sometimes when you do malaria, it shows positive. But after this herbal concussion, like malaria is gone. Okay. So why I don't advise it is because, like she earlier said, this hyperconsumption, they don't have dose. You don't know how much is taken into your body. So when you take excess of this herbal concussion, you end up overworking your kidney. So that is why you have
yeah.
to be careful of the herbal concussion you're taking. You might end up overworking your kidney, your liver. These are organs that needs to be protected. All right. So growing up, I've come. Yes, I took it. It worked. But if I was taking overdose, if I was taking it in excess, definitely my I don't know what would have happened. Maybe kidney, liver issues. Because these days, there is a lot of kidney damage. There is a lot of organ damage recently, and you're hearing about organ transplants, kidney transplants, and things like that. We just have to be careful with the herbal concussion we take in. And also, what I advise sometimes these are homemade medications back home can help. You must take if it is NAFDAC approved because these days we are having
Ye-
a lot of herbal concussion, herbal mixtures that are NAFDAC approved. That is, it has been scrutinized. It has been scrutinized by
Yeah.
our National Drug Food and Drug Association. So if you see these herbal concussions, these herbal medications that are being approved by the NAFDAC in Nigeria, you can take it. That is what I say. For it to have been approved in NADA, it simply means that it's working and they feel it's going to be better for their community. So I know back home there was what we called Ewu Monastery. Ewu Monastery, they produce is like a Catholic where monks gather, where monks stay. They actually do a lot of herbal treatments and it's NAFDAC approved. So I don't know if they have for ulcer, or I'm not saying they have for ulcer, what I'm saying is that whatsoever you are suffering, and if you have a hyper treatment for it that is approved by your country, I'm not saying by your native doctor or something. I'm talking about your drug association, those in charge of your drug and food. They've approved it that it is safe for the people. Then you can go ahead and use it. But if it is not,
Yeah.
you are putting your life at risk. So that is my
Yeah.
take about native treatment. Okay, I'm not saying you
Yeah.
don't,
That is.
but you just have to be careful. IQ.
You know, belief is wonderful. Whatever you believe in works for you. That is it. Even in medicine, if you
That's
believe in the
that's
doctor, it
that's
works.
placebo effect. I think that's the name for it. Placebo, right? Pharmacy. I think there's what we call placebo effect, in which says that because yeah, okay,
Placebo, like Placebo. Yeah,
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 yeah.
yeah, yes.
I don't
That
know
is
I don't know if I'm pronouncing it well, but I know there's something called placebo effect where you believe that this medication is going to work for you, and it end up working
it
for
works.
you. Not because there's a
Yeah.
science behind it, but because of the belief you place in it. So if you believe the native treatment is going to cure you, it's possible because of your belief that native treatment is going to cure you. But can't me out. Okay. So that's all.
You know
Okay.
that that placebo, just that placebo is just like empty drug, shell that
Yeah.
is just being like some patients are very funny. They just believe in it must be injection. It must be injection. So if some patients like that, even if you just give them injection water, they are fine. And they will be fine. Actually, they
Yeah.
will be
I've had
fine.
I've had
So that is
people walking
just what
up to the health center when I was doing my clinical posting and tell you, nurse, tablets not they work for me. Now injection.
now.
Sorry, for those that are not Nigeria watching, what I mean is that I've had
Yeah,
situations where patients walk up to me and they are like, "Nurse, in a tablet does not work for me. If I take tablet, it's not going to cure my malaria. It's not going to cure my typhoid. What used to work for me is injection." Seriously, these are people coming up. They say it's only injection that works for them. So sometimes you have no choice because you try as much as possible to explain to them, but they so much believe in that injection. So I'm not the one I gave them, but I'm just telling you what my experience was. So we had people. So please,
yeah,
we are going to be ending this live soon because the live ought to stay for just 1 hour, and I believe Pharmacist Gift has done well with the whole explanation. So somebody asked, "What do you think is the best way to prepare for a zombie apocalypse?" I don't know that. I've not heard about that. Sorry,
no.
Zinchi. I don't know about zombie apocalypse. I can't answer that. And I think Pharmacist Git is already nodding her head and she's like, she cannot.
That is we
I
are
don't know. I don't know. I
it's
don't
now.
know. We've talked about the
Zombies are
causes.
how.
Yeah, we've talked about the causes of ulcer. So if you want to watch, we said it's caused by Helicobacter pylori. That's 75% of ulcer is caused by that, from what Nurse gives showed us. So we've talked about the treatment already, Richard, for those that are asking. How can you get rid of ulcer? We've talked about it. We talked about the fact that the cause of ulcer is unknown. That's caused by Helicobacter pylori. Now the management in terms it has to be managed, it cannot be cured totally. So you have to be careful of what you eat. We've talked about that already. For those that missed all
Yeah.
these ads, all you can do is to go back and watch the full life video and get more information. Okay, we have Simiyu Bukola watching. David Okasne said the other video you did not mention the gel for the men. It is actually called Eroxon. Eroxon is a gel that has helped a lot of men with erectile dysfunction. So I made a video on it, but you can give it a try and see if it's going to work for you. It's been approved by the Food and Drug Administration of USA. It's been approved in UK, in European countries. So it's been sold on Amazon. So people in UK, they want to get, all they just need to do is to search on Amazon and it pops up. But I don't know how they can get it in Nigeria. I don't know. I don't know if you have. Oh, I'm talking with the pharmacist. Do you have Eroxon?
Please spell it.
Eroxon. It's like a new drug for erectile
No,
dysfunction. It's a gel.
no, I'm not sure it's in Nigeria yet.
Yeah, I'm
I've
not
not
sure.
heard of it. Aerosol. Okay,
Eh,
aerosols are like SOL, but this
No,
SON, no, no,
no, it's
I've not.
Eroxon gel. It's just been approved in USA, and I think it has been approved in UK for some time now. But it was approved in USA August 2023 or so. I can't really get. I think that was the date. It was the period it was approved in USA. So it's for men with erectile dysfunction. All they have to do is to squeeze the cream on the penis. That helps to help them with the penis staying erect during sexual intercourse. So I made a video on that explaining it, and people have been asking me how do I get it in Nigeria. But I don't think it's in Nigeria, and I don't know how it's going to get to Nigeria. I don't know if Nigeria has approved it for their citizens to use it. Okay, so
I'm,
that's why
I'm not sure. I'm not sure, but I will check on it.
you can check Ericsson. Like it's
Yeah.
all I just need to do if I want to get it. I don't think I need it. If I want to get it, I'm not a man. I don't need it. It's just to search for Ericsson on
For your
Amazon.
client, for your client.
It's just a search for Eroxon on YouTube. I think it's about 20 something pounds. I can't really remember the price. I don't know because the day I was making a video on it, I had to start checking about it. And so we have, please, what can I do to get rid of ulcer? We've talked about that already. I've answered that.
Yeah.
Good evening, everyone in the house. Thank you. I have stomach pain since last week. But okay, somebody said, I have stomach pain since last week. But I noticed that anytime I eat something, the stomach will stop and start a few minutes again. What do you have to say?
Okay. That is ulcer that you've not treated, that you've neglected. Okay. The pain will relieve when you take in food. After that, it will come up again. That is ulcer that you've neglected, and you need to go and treat yourself. That is it. So don't play with it. Don't just play with it. Just go and look for a way to treat yourself. That is just the whole truth. Okay.
I think that's last. If you have any question, kindly drop on the comment section. If you have any question, drop on the comment section. Just a quick reminder: tomorrow we'll be having a live video with Dr. James Komolafe. He's a forensic sex expert. I've posted the flyers on my DM and also on Facebook, on YouTube and Facebook. He's a forensic sex expert, and we are going to be discussing 20 symptoms or signs of a malnourished sexual life. So if you think you are sexually malnourished, as my followers, I'm not saying, or if you are doubting that you are not satisfied sexually, you're having a doubt as couples, as partners, you're having a doubt when it comes to your sexual life. We're going to be showing the signs and how to deal with it. We're not just going to be telling you the signs of a um, um, sexually malnourished life. We're going to be telling you how to also deal with it and answer it. I am a nurse, so I'm not a sex expert. Even if I talk about sex and reproductive health, I'm not a sex expert. So that's why we're inviting a forensic sex expert. He's a doctor. He's a behavioral therapist. He has had a lot of clients, dealings, and help people bring back their sexual life. So we're going to be talking about how to help you out tomorrow, the signs and how to deal with it. So what our advice is going to be like, I think it's 5 p.m. tomorrow. I'll drop the flyer tomorrow. So we're gonna be dropping the flyers. Check on our YouTube page. You're gonna be seeing it on our Facebook, and we're gonna be here tomorrow. So I hope to see as many people as we can. To all those that were present here, we hope to see you tomorrow for another interesting section. And I'm glad we're able to have pharmacist gifts. Please and please just search for pharmacist gift on YouTube. Follow Who Know Road. For all my Nigerian people, you know what I mean. So follow Who Know Road, ask questions, ask people questions that are familiar with the topics, not just the roadside chemist. So you can ask a pharmacist. I think if I was not pharmacist, sorry, why am I calling you a nurse? If I was pharmacist gifts, I think the best thing for my YouTube channel would be ask the pharmacist. That's what I would have given my YouTube channel. Like ask the pharmacist. I am the pharmacist. You guys should come and ask for me. Come and learn about drugs for me. So anyway,
Thinking about that is wonderful. That is wonderful. It's a good one.
I think you
You
have
know,
to pay me some cash for that. Hey. So it's actually nice having you around. Thank you very much for thank you very much for your time. Thank you very much. We have people. You people should drop a comment for pharmacist gift. It's not really easy. Like I earlier said, talking is not as easy as it seems. Okay,
it's
it's not
not
as
easy.
easy.
It's, counseling, talking to patients,
It's
trying
not
to
easy.
make them. It's not easy. So also, if you have any drug challenge, pharmacies, we are mainly drug people. We are like the drug lords. Yeah, we deal with drug
Ah,
and work with
drug
drug.
lords. Like, is
Yeah,
it the drug lord that I know or another drug lord they're talking about?
we call ourselves the legal ones,
Okay,
okay?
legal drug dealers, not the illegal drug lord.
No, we are the legal ones. So you can ask me about any drug that you want to know. So if I know it, and I know almost most of them, not all of them, please, but I know most of them. So anyone I know that I can help out, I'll surely tell you what the drug is, the side effects, why you need to take it, and what you shouldn't take the drug with. I'm going to tell you a lot of things about the drug and other health conditions, like most of the health conditions that are common around us, like malaria. Let's just leave malaria, asthma, all
Not
these
only
other
malaria. Oh,
common.
I think have you made a video on malaria? I think malaria should not be
Yeah,
left out.
I have a video on malaria where I talk a lot. Malaria can never be left out in
No,
Nigeria
I
because
think if you are
Nigeria is,
if you are a Nigerian like me, I would advise you watch
yeah,
that video on malaria because malaria can
yeah,
kill. Malaria can lead
yeah.
to death depending on the severity of malaria. I think you should browse about malaria, like the death ratio in malaria. Like just read about it. You see
It's
some
very,
people, a lot of people are dying from malaria. That is something like cerebral
yeah,
malaria or something like that. Like I don't know.
yes, yes,
So I don't want to
yes.
get
That is,
anybody confused. But people are dying from malaria. If you are in Nigeria, I would advise you to watch videos about malaria. At least she has one videos done on malaria. So you can search her YouTube channel for malaria video, watch and stay informed. If you
yeah.
have any question,
I've witnessed a kind of cerebral
yeah,
malaria.
I because it goes to the brain and everything just become worsen.
Yeah,
So try as much as possible to um get your malaria sorted out. Not that you have malaria, you start your I see, I'm gonna confess. And I'm gonna confess in this video. Now it's confession time. Like I was part of the people that hated malaria drugs. The smell of malaria
wow,
drug, like the smell of malaria drug drives me crazy. Like
wow.
when I start my malaria medications, I don't finish it.
Oh,
So, but I'm a born again now. I don't do. So when you don't know something, you
yeah,
abuse the opportunity because you have no knowledge of it. So now I'm not
yeah.
knowledgeable. Like before I got into nursing school, I abused malaria drugs. How did I? Don't get me wrong. In the sense that I don't finish my medications. Like when I take the first two doses and I see the symptoms are gone, that's it. And also, malaria drugs, they make me weak. Like, I can't even function. And me, I just want to leave the
Wow.
bed. I just want to move. So, I was really mad at malaria. I was mad. Like, I abused drug, but thank God that I was able to scale through and I was able to get informed and more knowledgeable. About
Nurse, were you one of those that used to put your malaria drugs in your swallow?
I did it when I was very small. I did it a lot. I like it's confession. Like I said, I'm confessing. Let me confess on my sins now. But thank God for knowledge. Thank God for education. You get. I was worse. I put my malaria drugs inside a bar. I'll use it to do this. So at least I will not have the taste. I will not even. And when I'm doing it, I'll still close my nose. But
Wow.
um, when I started growing, I had to start forcing myself to take the complete dose till I got a remedy. And guess what was the remedy? This gel malaria medication. Is it Amatem? Uh,
That is Artemata. This soft gel.
Yeah,
Amatem.
that's what I now take. So if you are very, very scared of malaria, before I left Nigeria, that was my malaria medication, the gel. Yes, it's expensive, but that's the only thing I take for malaria. So if it's malaria, I just take that gel and I'm good to go. So I don't even feel weak with it. I don't know why. I don't feel weak with that. I just take it. I finish my dose. I complete it. So it's kind of different from the other malaria drugs. So if you are someone that is scared of malaria drugs, I would recommend you take that gel. It worked for me. You can talk to your doctor about it. Like I say, I'm not telling you to self-prescribe. So it's just for you to talk to your doctor about it and tell them you prefer the gel part, you're having malaria. This is what you will prefer. They can go ahead and give you the gel because it's more tolerable in terms of the smell. You just pass through your throat. It's not even bitter. It's just like taking bubble gum.
Yes, that is it.
Yeah. So
It's not. Yeah, so there are lots of different ones that are palatable now. So
that's good.
malaria, because of the way malaria is so much in Nigeria, there are a lot of they are producing a lot of drugs. So, but the one thing I've noticed is that please, it's not about the taste. So that bitter one, they wipe a lot. You know, I've had malaria before, and me, anytime I have malaria, I like those bitter ones.
Ah,
I would like to, and I would go for the 4 4, the ones that have 4 4 because after I take 1 2, I will start having the relief before and I will finish
mm-mm,
it. So
mm-mm,
I prefer those rather than
mm.
I'm still with drugs. I'm good
No,
with drugs. Injection.
no. Generally,
That is
I'm part of those people that prefer injections to medications. Yeah, I prefer
ah
injection. Just give me the injection and no, I am done with the injection, not medications. I don't like the smell of drugs. It's kind of annoying me. But now I am the healthcare prof. And the funniest thing that where I work, like I do more of injections. I give more of IV, not even IM, than tablets because it's post-op theater. So our patients they hardly take tablets. So I'm lucky. So I don't get to smell those tablets regularly. So I'm lucky because I just give more of IV as post-operative nurse. So it's actually favorable for me because the smell of drugs, especially malaria drugs, I will never forget. It's like I'm saying it now. The smell is entering my nose. Right.
back then. Thank you very much. I still remember when we went to primary school to enlighten them about pharmacy and everything. The students have to tell us that they will not study pharmacy because of the drug. Almost all the students that they will not study pharmacy because of the drug. So we have to put them through that there are a lot of areas when it comes to pharmacy, not just the hospital
It's
and the
mess.
drug
I don't like it. I
not like
just give me injection and let me go. But there are some situations I have no choice, but I just have to take it. But if there's an alternative, if there's a plan B, I would speak with my doctors to give. Here I'm a nurse. I can't even prescribe for myself. Here I am. That is a fact.
okay.
I can't buy
Wow.
medications myself. No. Here I can't. If I'm sick, I can't. You know when you're in Nigeria, let's talk now. I
Yeah.
can easily put drip and I'll be waiting. But here, even if it's small, like small fever, you have to go to book an appointment with your GP, get the doctors to prescribe for you. I can't prescribe for myself. I can't treat myself. I can't treat my daughter. I can't treat my husband. So
Seriously?
that's just it here. You have to go through the doctor. The doctor have to do their prescription. You take the prescription and go and get your drugs from the pharmacy. Without the prescription, no pharmacy is going to give you any drugs. So,
Wow.
so that's how the
Oh
system.
my
So that's how the system here is. So one thing about this system is that you're just used to where you're working and how it's working as a nurse. For example, I'm used to my theater medications. I give, but I can't prescribe. I can't go ahead and give medications. Unlike Nigeria, where you as a nurse, you can own a big pharmacy. You can even treat. You can do a lot of things. You know circumcision back home. Sorry, we are done with. Sorry, we are done with the ulcer. We are doing more of a discussion. So we're talking out of what we're doing. So back home, you can easily treat. You can easily do circumcision. You can go into a chemist where a nurse is, and you tell them, "Madam, I want to circumcise my child," right? But here,
Yeah.
I cannot, like back home I can circumcise, but since I came here, I have not. I can't even circumcise. I am not licensed to do it. You are a nurse does not mean you
Wow.
are licensed to circumcise here. You are a midwife does
Wow.
not give you the go ahead to start circumcision.
Wow.
So you're a midwife. In Nigeria, all midwife can circumcise,
Yes,
but
that is
here,
it now.
no way.
Do it. Now.
So it's more or less like being a. I think there's a name for it. They call this practitioner circumcision, some practitioner here over here. So even circumcision now is a big name, and to circumcise is a big amount of money, right? So it's more or less like I'm a nurse, but I'm just restricted to the theater. Unlike back home, where you can treat malaria, you can treat typhoid. They see you as a mini doctor back home. You understand? You can do a lot of things. But over here,
That is
you can't even take your license to go and buy medication. Nobody will sell for you. The doctor has to prescribe for you.
that is quite annoying.
It's just, I think
It's,
it's a working system, I would say, because that's going to help, like, curtail that drug abuse. Though we have people, it's
yeah,
normal for you to have people in countries abusing drugs and all that. It's going to help
yeah,
curtail abuse of antibiotics. Like, back home, you can easily go and, like, oh, I want to buy antibiotics, just buy it, even without prescription. The pharmacist is happy to give
yeah.
you medication. So at least my business is booming. The chemist man is happy. At least my business is booming. You get,
But
but
they allow pharmacists to prescribe for
I don't
themselves,
know
like
about
themselves.
allowing pharmacists to prescribe for them. I don't think pharmacists can prescribe for themselves. Yeah. You have to get a
Ah,
prescription from the doctor, a licensed doctor that is prescribed. That's like, I they have a way of doing their things here, which is quite different. You get, it's quite different. But sometimes I see reasons to what they are doing. Sometimes I feel they are too harsh. Sometimes, but in all, I think on the long run, they are helping curtail all this
yeah,
unnecessary buying of drugs irrelevantly and things like that.
it's,
Especially now when
they
you
are really
Especially now when you have what they call it now, antibiotics abuse. Like people abuse
you.
a lot of antibiotics in such a way that when it's time for them to take antibiotics, it's no longer working because their body has now built this resistance to it.
Ulcer too. This ulcer too, most persons will take antibiotics. This is not working because most of the time when they carry out this laboratory investigation for ulcer, this Helicobacter pylori, we don't do sensitivity test. Okay, we don't do sensitivity test. Which antibiotics will be able to kill the
Yeah,
organism? That's what sensitivity test is all about.
yeah.
We don't do it. So we just select randomly and give. And most persons have abused these antibiotics, especially ampiclox, amoxicillin,
Big
all
time
these.
ampiclox.
Yes, they have abused them so much, so it's not working. As for me, if ladies come, just forget about ampiclox. I'm not gonna give you because I know it's no for. It's
When I
not
know
gonna
I'm
work
paying
for
you,
you.
say the truth. What do you give me? I'll give you money. Your business will boom. You will say. Say the truth and let
But nevertheless, I still love my country though.
So that's just it though. But anyway, that's practically it. I think we've spent a lot of time. My battery is even going down because I actually finished shooting before I did this live. So
Oh,
I actually had, you see, this is one of my scripts I use for shooting. So I've not, it's been a busy day for me. But I said I was gonna keep to my word and we're gonna have this live to actually inform everybody. Nursing Knowledge by Rahul. How are you doing? And trust you are doing great. You are also a nurse. Nice having you on this live. Kakarot Young. I was not circumcised. It's nothing bad. We have a lot of men that are not circumcised. You get, it's just
yeah.
we Africans they expect us, like all men should be circumcised. That's just our tradition. So in the UK, in most Western country, some men, I will not say most because I don't have a research record, that some men are not circumcised. Okay, so it's not a bad thing. Be it circumcised or uncircumcised, cut or uncut, it's fine. We are all unique. We are all good. Okay. Mona Franco, Banana Goon, Naya Omari, Thomas Sarak, Steve Ford. Thank you very much, Steve Ford. Steve Ford is somebody that's always on my life, be it on Facebook, on YouTube. He's actually he actually resides in UK, and he's always on my life, and he's actually um dating a Nigerian lady, which is actually a good one, a white dating a Nigerian lady, and he actually appreciates Nigerian ladies a lot. Thank you very much for joining our live. Esquity said, thank you, Pharmacist Gives. God bless you, ma'am. So they are telling you thank you for showing up. They appreciate. We have people from Bangladesh and oh, Bangladesh. I've heard about Bangladesh. How are you doing? I trust you are doing great.
Yeah.
Yeah, Steve said yes, UK. Thank you, Steve, for joining us. Steve, you can also support Pharmacist Gifts on our YouTube channel. Follow her and like. So we have Mohammed Tayyab Sahel official. Mohammed, how are you doing? And trust you are doing great. The live session is coming to a close now. We spent 74 minutes, 54 seconds already. So that's actually a long way to go talking. Thank you all. We've taken all your questions. We've answered all your questions in regards to ulcer and peptic ulcer. And if you have any questions in regards to drugs, don't ask me. Go to Pharmacist Gives because she is the licensed pharmacy and she has a YouTube channel. Okay. I am a nurse. I am not licensed to do any prescription. I am in a country where I can't prescribe, so don't ask me. So where nurse gifts, pharmacist gifts is, she can do some prescribing, she can do some treatment in Nigeria. So for where I am, I can't do any of such. So that is what I'm saying. Meet up with her, chat up with her, ask her questions, and I believe she'll be able to answer it. I'm going to be dropping the link on our YouTube channel on the comment section and also on the about section so you can follow her and learn more from her. Okay. So thank you, everybody. And Nurse Gift, you can say your final words before we go.
Yeah, thank you very much, nurse. The nurse with the difference. It was wonderful. I never expected it to be this lively, free, and wonderful. I thought it's gonna be like some kind of but you made everything fun. This is my first time being live on
Yeah,
YouTube.
that's
So
nice. That's great. So
yeah,
you should have
you made me feel free, and I was able to talk freely, and I love it. I wish we could have more of this though. I love it. Thank you, viewers. Thank you, nurse. Thank you, viewers. Everyone, please follow me on YouTube. I'm in Nigeria. If you're you can still come. I can treat you, take care of you. We are free to treat. Okay, we also have nurses in our places. We don't give injections. We are not allowed to give injections and everything, but we have nurses. When we have known the drug interactions, everything, we say, nurse, give this, give this, give this. The simple one that we can treat, we can treat. Then the ones that are bigger than us, straight to the hospital and to the
what's
doctor.
the name
So
of your
please
pharmacy?
follow me on YouTube at Pharmacist God's Gift. Thank you. So don't forget to ask your pharmacist when it comes to drug matters and health information. Thank you very much for staying.
Nice. Bye, everyone. Thank you very much for joining our live. See you in our next live tomorrow. It's very important. We're going to be meeting with a forensic sex expert, Dr. James Komolafe. So if you are married, sorry, this particular one is just for the married couples because we don't want the singles to get their brain messed up. Okay. So see you tomorrow, 5 p.m. Yeah, 5 p.m. So I'm going to be dropping the flyers on the YouTube channel again as a reminder. And that's it. Thank you, Steve. Thank you, Mohammed, for saying bye. We love you. Thank you all for staying tuned. I really do appreciate, and I don't take this for granted. Bye, everybody.